Thank you. Good evening and a very big welcome to everyone listening in. This evening we've got in the Royal College of Surgeons webinar series, we've got a webinar specifically about issues affecting Ukraine. This is a very topical area, and over the last few months I've really enjoyed and benefited from meeting Ukrainian doctors here in the UK and those involved in the response to the really distressing issues in their home country. And we've got four great speakers here, each of who's going to talk for about 10 minutes or so, and then we'll have a period of time for questions afterwards. And so I'd like to introduce the speakers, but firstly, let me tell you who I am. My name is Chris Lavy, and I'm a spine surgeon here in Oxford and on the Council of the College of Surgeons. Our first speaker is going to be Professor Roman Cregg in London, who is president of the Ukrainian Medical Association of the UK. He's a consultant in pain medicine and anaesthesia, and he currently works within the National Hospital for Neurology and Neurosurgery and University College London, NHS trusts. And he's highly specialised in the treatment of musculoskeletal, neuropathic, chronic and cancer-related pain, as well as the management of acute and chronic and cancer pain. So a big welcome to you, Roman. We're then going to move to Dr. Tetyana Vovnyanko. And Tetyana is a trustee and co-founder of the British Ukrainian Aid charity, which she'll tell us a bit about, founded in 2013, that supports people suffering from the war in Ukraine by aligning UK and Ukrainian efforts. And Tetyana has a PhD in psychological sciences and has extensive experience in teaching and research and educational administration, and currently she works at the University of West London. Next will be Tania Herbert, and Tania is the West Midlands Coordinator for Medical Aid Ukraine, which is a collaboration between the Ukrainian Medical Association and the charity British Ukrainian Aid. And she works as a GP in Coventry and is the mental health champion for the Soe Valley Primary Care Network. She's originally from Kyiv in Ukraine, but grew up in Liverpool and graduated from Cambridge University and King's College London. So look forward to hearing from you later, Tania. And then last but not least, our surgical representative, Jaroslav Rospapa. And Jaroslav was born and grew up in the Western Ukraine in the Transcarpathian region. And after graduating, he moved to Eastern Ukraine to Donetsk in 2007, where the war started in 2014. And Jaroslav did his postgraduate work in burns and plastics, graduating with a PhD. And then in 2015, 7 years ago, he moved to UK. And since then, he's worked in a number of plastic surgical units. And currently, he's a trainee in Addenbrooke's Hospital in Cambridge. So look forward to hearing from all of our panel. And Roman, I'd like to ask you to start to fill us in about the Ukrainian Medical Association and where you've been to since the events of February. Thank you.
Thank you, Chris. Thank you, everyone, for your kind invitation. Can you still hear me well?
Very, very well, thank you.
Wonderful. Thank you. My name is Roman, and as Chris mentioned, I'm an anaesthetist. But then again, nobody's perfect in this life, so here we are, sharing some of our experiences in the background. And I think that before we start, I have probably the most important announcement to make is a gesture that every Ukrainian around the world will share, is a expression of gratitude to Britain, to its establishment, and every single person who contributed to the Ukrainian cause over the last years, and more specifically months. it was humbling, and I think that all of my colleagues present here and who are listening in or not present here, but as I said, every Ukrainian would like to share this profound expression of gratitude towards the British public and establishment for everything that they do and have done and will be doing for the Ukrainian cause. This is amazing and overwhelming how everybody is touched and how every person who comes to the UK feels welcome, feels supported, and feels enabled to do everything they can do before they decide to come back home when the war is over. So thank you again on behalf of the Ukrainian Medical Association and the Ukrainian community here in London and UK and beyond. A bit of introduction on what the Ukrainian Medical Association is. It's probably 10 years old, and since its inception, Dennis Ugrin, my colleague, was the founding president, and then I've taken over some time later. I guess the major intention was to support the Ukrainian community here, support migrant community who had difficulties accessing healthcare because the healthcare is slightly different, as you can imagine, and also supporting doctors who wanted to move here for pursuing their studies, research, etc. And then some assistance to the reforms in the Ukraine, which have been happening since. It's always been reforming something or the other in the healthcare. So that's what we did. And then 2014 came along, and obviously the invasion started not in February, but in 2014 this time around. And so we were more involved in obviously supporting and fundraising, and that's how I met Tetyana, and we've collaborated closely since, because UMA UK is not a charity organization. Our mission is not to raise money or collect money. Our mission is to support the doctors, and we've collaborated with Tetyana and a few other charities here, but predominantly with Tetyana's British Ukrainian Aid, who have been our go-to people for fundraising. So that's how we met. And then fast forward to sort of 2022, when everyone's Ukrainian certainly life has changed, where there was probably 50 of us as a group. We are pretty open, and anyone who wants to join is able to join as long as they have some affiliation to medicine or Ukraine. So we had a bunch of psychiatrists, pharmacists, nurses, and predominantly we were just fundraising and meeting once a year. But obviously that has changed in February 24th, and since then it was an explosion of activities, explosion of obviously requirements and needs that were channeled towards us from the Ukraine, asking for help. But equally and quite surprisingly, that amount of noise was coming from the UK community of physicians saying, how can I help, what can I do? And I remember that call from Natalia Chaprina, who's one of the GPs who's not in the UK. She moved to Switzerland with her husband, Swiss. She called me a few days later and said, look, Roman, I have this bunch of doctors asking me what to do from the GP network, and I really need to sort of, collect everyone's from the Ukrainian Medical Association, and we need to sort of do something, because I certainly am approached by many, many doctors. And I said, so am I. And that's how we initiated this meeting. And over the day, the Facebook group had like 400 or something participants, predominantly medics, but volunteers of any sort, that we had to basically marry in their intentions with the Ukrainian counterparts. And many people went to volunteer there, went to the Polish border helping with the migrant crisis there, and also were fundraising here. So I'm certainly going to stop here describing what has been happening, because I know for a fact Tetyana and Tania will go into it in much more details, because they're the ones who did all the work. So there's more to come on that. But I guess 4 months down the line, I see a lot of relationship and similarity with pain. Of course, it's painful, but also you have this acute pain going to chronic pain around the mark of 3 months. And that's what we're experiencing. First 3 months were driven on adrenaline, and we're driven on sort of, trying to grab everything is offered and somehow ship it in cohesive way to the Ukraine, and then hand it over the border and run back to do some more. At the beginning, we didn't have any trucks and lorries and other people who volunteered their help. So we were basically, me and Dennis, I remember driving 2 days later, because a hospital in Ukraine, particular one that we know, needed a specific amount of humanitarian aid. So we just took the cars and went ourselves. from then it's grown. But ultimately, the time has come to reassess. And unfortunately, on this occasion, acute pain became chronic. So the war that we were hoping will last for weeks is going to likely to last for years. And we as an organization, together with partnerships that we've established over the last few months, are considering how to assist in a more organized way. And we're sort of, reaching out to a few institutions and to see whether we can sustain their needs over the longer period of time, but at least cover a few hospitals effectively and fully, rather than obtain 100 letters with different things, and those 100 letters are sent to 100 different places. So matching and not over supplying someone because someone else volunteered was an extremely difficult task to manage. But I feel that the organization also needs to tap into a variety of doctors who arrived here and find partners within the UK medical community and colleges, and certainly there are surgeons available. So we want to support and introduce those who want to continue working. Certainly all the doctors do. I haven't heard anyone thinking about changing the career. So there certainly will be more requirement and support for those individuals as well, and integration into NHS, English, PLAB, examination or other routes of registration with the GMC is something that we'll be tasking ourselves with for the next few months. And again, expressing my gratitude to Chris for offering those channels of communication and for supporting surgeons who want to pursue their work. So that's our sort of plan for the future, but we also want to somewhat channel our energy in expressing our gratitude to the UK community. And there are certain volunteering projects that a lot of Ukrainians want to do. We just need some ideas, whether it's to clean the park or do something else. But there's certainly an overwhelming desire of Ukrainians who arrived here to do something in return. And you'll hear about it when and if it happens. So thank you for invitation. And I look forward to listening to other speakers who have much more substance than myself. Thank you.
Chris, sorry, you're on mute.
Thanks for reminding me. Okay, thank you, Roman, for keeping to time. Just a word to everybody to say, if you've got questions, please put them into the question box, and we'll share them around after everyone's spoken. And so thank you, Roman. And now, Tetyana, if you could fill us in on setting up the charity that you did almost 10 years ago.
Thank you, Chris, and I'm delighted to be here today to tell you more about British Ukrainian and about Ukrainian diaspora's response to the war in Ukraine. My presentation is, next slide, please, Eduardo, if you can. Yeah. I would like to address a few points in my presentation, and they're listed here on this slide. And I will start with the short introduction of the British Ukrainian Aid charity. Our charity was formed in 2013 and as a volunteer initiative at the time when Euromaidan happened, also known as the Revolution of Dignity. And we were driven by desire to help the people wounded and injured at the Maidan protests. And later on, when the war started, we wanted to continue, and the need was larger and bigger scale. So that's how we transformed and we became a proper charity. We are the group of like-minded people who feel passionate about Ukraine's positive impact on the world, its stability and future. And very important that all members of our charity are volunteers and work on the charity's projects after their day jobs. So it actually allows us to be very efficient in terms of spending our funds, and everything what we have, what been fundraised, donated, it goes towards charitable projects only, with no reimbursement or paying any salaries or paying for the services of people who help us. Next slide, please. And the British Ukrainian Aid is one of many Ukrainian organizations working in UK for many years. and the logos of some of them you can see on this slide. Of course, I wanted to put all organizations, but strictly because of timing, I will mention just a few. The Ukrainian community in the UK has a long history and own institutions, the archives, the community school, and there isn't any definite figures which would allow us estimate the size of the Ukrainian community or the social composition of the Ukrainian community. However, I can tell that we divide the Ukrainian community in three main groups. These are post-World War II immigrants, their descendants, and migrants from independent Ukraine. All diaspora refers mostly to the Association of Ukrainians in Great Britain, AGB, which has been founded in 1946, and it is the largest representative body for all Ukrainians living here in the UK. And on the map, you can see the representations all across the UK. It exists to develop, promote, and support the interests of the Ukrainian community. The next organization, actually, it's autonomous section of the UGB. It's a Ukrainian Women's Association. It's been formed in 1948. By that time, almost more than 4,000 Ukrainian women arrived to Great Britain, predominantly as the European voluntary workers. And they still exist and work very actively. The UGB community here in London and UK have been actively engaged in protest and provided humanitarian aid to home countries since 2013 and even before that. There are, of course, younger generation. There is a younger generation of Ukrainians living in the UK, and they united in two organizations, which are the Ukrainian Youth Association in Great Britain, which promotes Ukrainian identity and patriotism, and also PLUS, the Ukrainian Scouting Organization in Great Britain that follows the principle of the international scouting movement, but with the Ukrainian characteristic. The next organization which I would like to mention, it's London Euromaidan. The dramatic events of recent years in Ukraine, the Euromaidan, the annexation of Crimea, the war in eastern part of Ukraine have inspired the new generation of Ukrainian migrants in the UK to get involved and to make powerful contribution to their home country. And this is how the London Euromaidan movement has been formed. And they were actively engaged in the protests and helping defenders back in Ukraine for all this time. Recently, it's been transferred in Support Ukraine Coordination Hub to address the urgent needs of people in Ukraine after the full-scale war launched by Russia. And the hub has been established with support of UGB. It works at the Holland Park premises, and it sends humanitarian help. It assist Ukrainian refugees arriving to the UK, providing them legal advice. And also I would like to mention that on the same premises we have the St. Mary Ukrainian School, which is Saturday Supplementary Community School. Founded over 60 years ago, still works. It's one of the largest Ukrainian community schools in UK, promoting the Ukrainian language and culture. And the number of students has increased significantly. The last time I spoke with the director and the teachers, there are more than 700 students studying there, and major part now of them, that's the kids of family who escaped from Ukraine since February 2022. So the drop in numbers has been very significant, and Ukrainian school copes very, very effectively with these numbers, and we hope we'll do so in the future. I also would like to mention two charities which are very well established and very well known in Ukrainian community. These are the Ukrainian Institute London. It's a center for Ukraine-related educational and cultural activities. And it's affiliated with the Ukrainian Catholic University in Ukraine. And another charity is Ukraine Charity, established in 2007. The primary focus has been on helping orphans and underprivileged children in Ukraine, but they also now cover another area, providing humanitarian help and medical aid to Ukraine, reorganizing and restructuring how they operate. To sum up this short overview of the Ukrainian organization UK, I want to say that mobilization of civil society has been remarkable in terms of level of engagement and participation across all segments of the Ukrainian diaspora. We join forces together to support the evolution of dignity. Roman already mentioned Ukrainian Medical Association here in the UK, and we are happy to cooperate and will continue our cooperation. And we will stay united to help Ukrainians in their fight and to help them in this unjust war, which shouldn't have happened, never shouldn't have happened. Next slide, please. And also I would like to talk very briefly about the main areas of charity help and activities. And I divided in two parts. There were activities we predominantly were working in before the full-scale war, and there are areas of help which we started covering after the full-scale war. And for us Ukrainians, 24th of February became as a date which changed our lives. And it's important to understand that the war for us didn't start now in February. It started in 2014 when occupation of Crimea has been annexed, when Donbass and Lugansk area have been occupied. And what we see now, experience now, is just the escalation of the situation which we had before. And speaking briefly about what we did in the past, recent past, we regularly sponsored art therapy and social adaptation courses for the former veterans and their families, participation of the group of the adaptive athletes in the UK tournaments. We funded scholarship for the former veterans, covering costs for the public management master's program at the Ukrainian Catholic University. We provided individual financial help to victims of war, delivered medical aid to the hospitals. One of the important areas of our charity is to advance the education of the general public in Ukrainian culture and its history. And I would like to move to another slide, please. And since February 2022, our main focus has been shifted to providing essential medical aid to Ukraine, its tactical medicine, ambulances, medical supplies, and equipment. Next slide, please. And to possibly answer the question why this area are so important, I would like to refer to the data which are available on WHO website. And it's possible to extract the number of attacks on the healthcare system in Ukraine for the period of time between 22nd February and 10th July. And because of today attacks in Vinnytsia, I would assume that one more medical center has been destroyed. So this number increased. So we can see here that in total, Ukraine had 369 attacks on healthcare institutions. 79 people were killed and 64 injured. Next slide, please. Actually, can we stay a little? This is the one. Thank you, Eduardo. And on this slide, I would like to refer to the press briefing which Minister of Health had in Ukraine on 6th July, and Viktor Leshko, he reported that 122 institutions were completely destroyed, 817 were damaged, 85 ambulances were destroyed, and 105 were seized by Russians, and what happened to them apparently we don't know. And 469 healthcare facilities are in the occupied territory. when we think about these numbers, the concentration of attacks and level of destruction and how many facilities have been completely destroyed or damaged, they're just astonishing. And if I may to compare with Syria, where the war lasted for more than 10 years and where Russia has been actively involved all this time, and when we compare to the level of attacks carried out by Russian forces and what they done to our system, and we have only one. We are at the moment we embarked 141st day of war, and it's hardly imagine what is ahead of Ukraine and healthcare system. And that's explained why at the moment almost all charities and all Ukrainian diaspora is concentrated mostly on providing medical aid to Ukraine. Next slide, please. One of the most important areas of our activities is providing, procuring and supplying tactical medicine to Ukraine, to the paramedics, to defenders, to the territorial defense group, and to the workers of fire brigades and state emergency department. And so far, as on 27th of June, we procured and supplied, with the help, of course, our partners, 24,188 IFAKs, individual first aid kits. Why they're so important? Then a threatening emergency happens. This little pouch, which you can see in the hands of the lady on this slide, can make a difference between life and death. And it's important for everybody because it can save their life. We will continue to do so. And just very briefly, what we include in these pouches and how we work. If we can move to another slide, please. So there are very important components which are being put inside the pouch, and these are tourniquets, hemostatic gauze, chest seals, Israeli bandages, nasopharyngeal airways, burn dressings. The short description is here. And very briefly, I just mention how it happens in reality. There are two groups, volunteer groups, working in two premises in London. And on this project, we cooperate with two organizations which are Support Ukraine and PLUS. The volunteers of both organizations, they assemble kits, and after being assembled, they go to war zones and frontline in Ukraine. We use the network of the courier, and very often the volunteers of our organization, our charity, they drive the vans and ambulances to Ukraine to deliver essential medical aid. I wouldn't, to save the time, I will not mention the challenges which we had, but I just mention that one of the current challenges is to find, to procure and supply the components for the IFAKs. It causes delays because, as you can see from list, we need to put at least 4 the most important components, and if we don't have any of them, that means that the volunteer group stops. And in order to overcome this obstacle, we are planning to start assembling them in Ukraine, working with the already established partners, because they receive the components from all over the world, from other countries, and they can establish the missing components, put them in our pouch, and send immediately to people who are in need. And another project which I would like to mention, and Eduardo, if we can move to another slide, please. That's supplying ambulances. So far, thanks to the financial contribution of our donors and partner organizations, we managed to supply 45 ambulances and paid for more than for delivery. We covered cost of delivery for more than 20 ambulances. Oh, I'm already over 16 minutes. Chris, why don't you stop me? I'm talking too much. All right, just if I may, because next slide, here you can see the destination, and if we can move to another one, I will stop briefly here, and I will the previous one. Let me just stay on the previous one. Yeah, here are very important pictures for us because it shows what happens to our ambulances. The first one has been sent to Mykolaiv, And one morning, I opened our WhatsApp chat group and I saw the links to the British newspaper saying that the ambulances, one of the British ambulances delivered to Ukraine has been hit by a Russian strike outside of Mykolaiv hospital. One child was killed, unfortunately, and more than 60 people injured. And we accepted the news. Well, it happened, and the child died, so the ambulance didn't have much value for us compared to the people life, but at the same time it was a sad. But a few days later we discovered that the doctor who actually delivered this vehicle to the Polish-Ukrainian border, he managed to drive to Ukraine and bring the important spare parts, and the ambulance was repaired and now serves in Mykolaiv. And the fate of another ambulance in our file is not so successful story. It's been donated to our charity by a very nice British supporter living in Holland Park area. And it's been given to the frontline paramedics. And a few weeks later, there was a mine explosion and the car has been damaged. They can see the state, which is the vehicle at the moment. And of course, it's not repairable.
Tetyana, I think I'm going to ask you to stop there.
Yes.
Great, really clear presentation of all the work that your charity's been doing. And we'll move on to Tania.
Thank you.
Thank you, Tania. If you can fill us in the work that your group's been up to.
Let me just get my screen up. Oh,
sure.
There we go. Can you all see that? Is that all working okay?
I can see it okay. I hope
perfect, thank you. So hi there, I'm Tania. I'm a GP in Coventry, but I was born in Ukraine. I've been here for nearly 30 years now. I think if you remember Roman Cregg talking right at the beginning about Ukrainian Medical Association and linking up with British Ukrainian Aid, and basically just doctors all trying to kind of find what can we do, how can we feel useful, maybe, I don't know, because I think me being Ukrainian, having family out there, you just feel very helpless, and that there was a chance there to actually be able to do something. I've heard that other doctors were speaking to their hospitals, to colleagues, to teams, saying, have you got anything that you could donate to us, because actually I've seen, some things standing around, that's brand new but not being used, extra stock, what can you donate? And actually people were getting quite a lot of offers of things, and they were being transported. So I thought, yeah, I think I'd love to do that. This front slide is just a little bit of a summary of some of the groups that we've worked with. Support Ukraine, Tetyana was talking about them. That's the Support Ukraine Humanitarian Hub, which is linked to AUGB and Euromaidan in London, Plast, obviously, and a few local charities that I'm working with locally in Coventry in the West Midlands. So group of Ukrainians basically have arranged a group which just packs boxes. So that's the Ukrainians in Coventry and Warwickshire Ambulance Aid, which I'll talk to you about later, which is just a group of non-Ukrainians who just want to help, and other local volunteer groups as well. And also International Christian Medical Association, ICMDA, and Stay Safe Ukraine, among many others that we've been working with. So a little summary of how Medical Aid Ukraine started. Again, Roman sort of went over that a bit, but Ukrainian Medical Association, which is kind of headed by Roman Cregg and Denis Ugrin, and they who have been working actually with Tetyana and Natalia before, decided that actually this was a really good way of getting the supplies that we were being offered into Ukraine, because they had existing contacts and links and we could get that in. And then also we started a fundraising branch. So far have raised nearly £100,000. I think British Ukrainian Aid also are raising money for the same sort of thing, but basically we are trying to fundraise to buy medical equipment, medical supplies that are needed. Let me just go back to my slide. Sorry, I don't know, just get off the can you see my presentation or the camera? Sorry, is everything okay? Yeah. Okay, I'll carry on. So our Medical Aid Ukraine sort of team, we've got regional leads in most parts of the UK, though we're still looking for some more. I'm obviously, yeah, Warwickshire, West Midlands, and I've got a few team members working in Birmingham, Nottingham, who kind of collaborate with me as we're local. Yeah, I mean, we've all sort of been doing kind of working together, but also doing our own, setting up our own sort of systems that work. And I'll tell you a little bit about each group here. So there we go. So this is my West Midlands team, a little bit about what we've been doing. So Ambulance Aid was set up from just basically people who saw what I was doing, had a bit of support from friends who can do press releases, or I don't know anything about that, but somehow they got me on BBC Midlands, and they saw me and said, that's brilliant, you know, we want to help. So they've set up like a company, basically, so not a charity, but a company which is fundraising specifically to buy ambulances, and we're also looking at other vehicles which we then take over to Ukraine and leave. I mean, really similar to how British Ukrainian Aid have been working, and many other groups, but yeah, so we're obviously a lot smaller, but it's been really handy just being able to transport the supplies that hospitals have been giving us, that local groups have been giving to us. So all those volunteer groups I was showing you have basically been asking for specific things that I'm asking for, kind of, you know, medical kit, trauma kit, sometimes, you know, things like dressings, whatever we can find, really, that's useful. Trying to limit it, obviously, to what's needed, and then they've been packing it, helping me pack and sending it over. We've been working with Lunar Aid as well, which was a group that was flying planes over. And yeah, it's just to pick up the pictures. A couple of weeks ago, I actually drove one of our ambulances down to the Polish-Ukrainian border, which was an amazing experience. You know, really rewarding, actually seeing some of the donations that we've been getting, actually getting there. And in the picture over here, I don't know if you can see, probably a bit blurry, but that's actually Dr. Chris Lavy there, who you may know, who also drove one of our ambulances down to the Polish border, which we're very, you know, very grateful for. We're still looking for lots of people who can help with these sort of things, but we seem to be, you know, have a good network locally and across the UK as well. And then we also had, just of note, the Holby City TV show donated their ambulance to us, again through a couple of kind of words from Chris Lavy, who knew some of the team, interestingly. And what we've been doing is, well, firstly, it needed a bit of work because it was a bit of an old ambulance, but we have had it serviced fully now. And in the meantime, while it was kind of getting ready to travel to Ukraine, we've been doing a few fundraising events. So basically taking it places, standing around, showing people what we've been up to, and sort of, yeah, raising money really to get more ambulances for Ambulance Aid. So that's been good. Obviously, whatever we have left after we've sort of ran out of ambulances to fund, we were going to give to British Ukrainian Aid, Medical Aid Ukraine, to buy more of the medical supplies to send over. The London branch, I think Tetyana spoke a bit about, so they've been teaming up with Plast. So Larissa Smondylak in London has been kind of leading with Plast, and also Support Ukraine UK, who've been collecting the stuff to put in the medical tactical first aid kits, really. So yeah, and I think that's I can't remember who that is, I'm sorry, there's somebody famous, you might recognize him. I think he's an American secretary or deputy vice secretary of state or somebody else. So I'm so sorry, I'm really bad with people's names. If I haven't met you, I won't remember. But he's somebody famous anyway. He came to see them being put together and apparently made one up himself. Yeah, now apparently they've been very, very well received in Ukraine. As you can see, this little text there says that one of the best they've ever seen. So really grateful. Wales branch is Matteo Schmidt and Marina. They've been also fundraising for ambulances through a group called Wales Aid for Ukraine. Have had lots of donations from their local hospital trusts. And I think that's Matteo over here with my dad, interestingly enough, because they've been helping them with some storage at the hospital. I'm talking about the university, Cardiff University. So storage is a really big thing that actually we need in local areas. So various places let us use their storage, and then actually kind of say, actually no, we need it back now. So people kind of having to look for that around. But yeah, Wales are pretty much sorted because they've got the university on board. Then Northern Ireland as well. So we've got Alicia Jasinska Piadlo, who's been doing similar, so packing lots of the supplies, sending them across to Ukraine, either via London or actually directly into Poland. And they've been doing also fundraising events and actually giving money straight to British Ukrainian Aid. So we're sort of working as a team together. South Central, Maya Uhurek, very similar. She was actually donated a large amount of hearing aids, which actually quite expensive. So this box here, I think, sort of talks a bit about that. But yeah, it's just actually would make quite a massive difference to people who, let's say, can't get anything new fitted. They've lost their hearing aids. There's actually a lot of care homes that we know about that are really struggling, as they can't evacuate. A lot of the elderly don't want to go, but they're just not getting things like sanitary equipment, hearing aids, glasses, just really simple things that you think be easy to get, but obviously all the supply chains being down, it's just pretty rubbish. Northwest again, they've had a massive donation, had a really good had a big donation from a hospital, and this actually went to the Neonatology Association in Ukraine, and this was I think from the Liverpool Women's Hospital. And so talk a bit about transport. So yeah, ambulances are really good ways of getting things right into hospitals or to the frontline military hospitals, which can be used there. Lunar Aid obviously was really helpful. So the getting the planes in, lorries, and also just sort of trucks, vans have been getting stuff in as well. We're now working with React Disaster Response, which is a volunteer team which have been helping us collect donations from across the UK, and are now going to start helping us get it into Ukraine and to the border. And a few more pictures of some of the deliveries arriving. I thought would be nice to see. I think this one down here is Kiev Military Hospital. This is Odessa, one of ours actually from the West Midlands. And this was in Mykolaiv back in March. So kind of a summary of what we've delivered. We're sort of talking here in kilos there. So a lot of it has gone to Kiev, but also quite a bit has gone to other parts in the east and the south. So yeah, and then again, kind of just tells you a little bit about what we have actually delivered. So in terms of the colours, this is actually local. This is actually just for the West Midlands. So it shows you actually we've still managed to get quite a bit in, even just from one area. And then there's a little summary. So I'll skip on to some videos. So I'll see if I can open this for you. Bear with me. How can I get out of here? I think I've got them open already. Right, so this was a little infographic that we had made up about, this was done back in May actually, so it's a couple of months out of date, but quite a nice little infographic which shows again in a nice way kind of the destinations that we got to, if it works. Let's see, it works. There we go. Move up a bit, bear with me. Yeah, so again, shows the kilos and amount we've actually delivered to areas. And partner organisations, as again we've talked about the British Ukrainian Aid, Neonatology Association, and actually the percentage here is in terms of a kilo. So actually that's why that's so big, because a lot of that was beds and cots, like ITU cots for babies. Yeah, so quite a few groups that we've been working with there. Types of aid, again, talks a little bit about, you know, what different so obviously we have sent over quite a few. I think it's nearly 1,500, something like that last time I checked, first aid kits, and then consumables, obviously quite a 20% of that's the kilo weight, and equipment, again, obviously heaviest, so that's why it looks so big, but obviously I've done quite a bit. And I'll just show you some quick videos, if that's okay, if I have time. So firstly, this was one that, it's only be quick, I promise.
This ambulance has needed some repair before it will go off to Ukraine. And tell me, this will be transported. This will be filled as much as we can. We need to check the load. We will fill this with critical medical supplies. The evidence that we took out, there were supplies that were genuinely going to save lives and change the vision they're going to be able to keep their limbs. With the situation going in the Ukraine,
Okay, so let me pause that one, and
perhaps we better stop there and just to give a bit of time to Jaroslav. Tetyana, one of the busiest people I've ever met. Whenever you call her, she says, "I'll call you back. I'm just packing." Thanks. And last but not least, Jaroslav.
Hello, everyone. Thank you for inviting me, Professor Lavy. I mean, it's very difficult to. My name is Jaroslav. I'm a plastic surgery registrar in Cambridge, as was said. I mean, it's very difficult to add something after such a good presentation of my colleagues and people who involving can have lots of experience in charity and in helping Ukraine. And as they said, that for us, the war started actually 8 years ago in 2014. Back in 2014, I was in Ukraine, in Donetsk, where everything was started. And I mean, I haven't been involved in charity as such, and I have very little experience by February 2022. What I had, though, I had the knowledge because I was lucky in 2014 of winning a grant and bursary for the course of total casualty combat care, which I and around 8 of my colleagues from Ukraine went to do in the USA. And we've been among first certified instructors of this course who brought this course back to Ukraine, and one of the first courses which we taught was in the military hospital in Lviv. After there, I was, and I still keep in touch with the international medical Ukrainian community and with the colleagues in the USA and as well as in Ukraine. We've been trying to contribute. I was one of the co-authors of translation of the TCCC to Ukrainian language as well. But then I moved to Ukraine, and kind of everything was kind of calmer from this country, even though I was in touch constantly with these people. In February 2022, it's kind of everything started very quick and very unpredictable. And I mean, we kind of were in this condition. It wasn't new to us, but it never was that severe. And I mean, that time I can remember very clearly because I was on sick leave, recovering from the fracture of my arm and the surgery, and I was just watching TV, and I was just thinking, like millions of people in Ukraine and outside Ukrainians, outside from Ukraine, and not only Ukrainians, how can we help and what can we contribute to, and how can we do this quickly? And that was the main problem in February, quickly, because a lot of people know what they can do, but they didn't really know how to react and how to bring that what's needed and where it's needed as soon as possible. And I kind of, based on my background, I realized immediately what people need, and I was started to concentrate on the tactical medical equipment, as majority of my colleagues here, like Tatiana, saying, IFAC, it's one of the most useful thing which you can bring where it needs to be, because it's useful not only for the military, but it's useful for lots of not military casualties which are happening every day in Ukraine. And I just sent few messages to few messages to the group of the registrars in my deanery, and to the registrars to my colleagues in the group in Cambridge. And unfortunately, I haven't been lucky. As you can remember the map from the Tetyana's talk, when the concentration of the Ukrainian community is. So it's basically London, and then it's mirroring M1, obviously where majority of the migrants moving to, where is more job. And I just happen to live in that blank area in the east of England, when there is very, very small amount of Ukrainians. And in fact, I knew only one, and they far away from medicine, and they've been involved in the humanitarian help, which is another massive topic, because we are here more concentrating on medical help and how we are helping medical system in Ukraine. But the humanitarian stuff, it's amazing job was done over there by very random people who has zero experience and who has zero relationship to any formatable charities. But that is a topic for another talk, I think. Anyway, I mean, I personally wanted to get a donation only of the medical equipment, but I was after tourniquets, I was after SEM tourniquets, I was after binders, and majority of my medically trained colleagues even didn't have clue what it is. Only people who on the kind of joint military slash non-military pathways, they've been first who responded to me, and those people who were donating quite a lot of cat tourniquets, which quite is expensive, small but very expensive equipment. And I was receiving, like, I mean, it's not 20 and 30,000s like Tetyana was doing, or Roman with the charities, but 200, 300 pieces per person. It's a reasonable amount as well. And those original ones, which were costing like £50 or whatever, £40 each. And they came to me and saying, okay, we have no clue what you're asking for, but we can give money. And I was like, I have never got an experience of fundraising and stuff. And then, I mean, fifth or sixth person convinced me that, you should start it. And I just went out there to the internet, found the first one which has the less fees to use, and started it. And I just put humble, aim £1,000, which I kind of covered in under an hour. And I've got money. I know what I was after. I just didn't know where to get it. And I take a Google map, Google the surplus store in the area, and I spent around. I was fortunately being able to drive at the time with my broken arm, but I went around and I bought everything. I could, and the support, it's not only a discount, absolutely immense I got, and I was receiving like which I quadrupled, if not more than that, simply based on the discounts and based on the extra stuff which people were just donating from that surplus store. And then some of the colleagues refer me to the Royal College of Surgeons. This is where I get to know Professor Lavy and a lot of wonderful and very helpful people. And this networking, which kind of makes a massive difference even for the kind of solo volunteer, because I'm not alone, and there are a lot of people who is doing massive job, but they just out of scene there. And I was lucky. I don't even remember how, but I got to know some people in North London who is buying, and that time, 2 to 3 convoys per week, including like 5-6 SUVs. And people like me, we've been just packing them and sourcing them. And you know, when there was a bit of uncertainty how to deliver hubs, a lot of things were stacking on the hubs, our equipment went straight away. And there were days when, you know, our equipment was on the battlefield within 72 days. And, you know, it went and went and went. And I kind of stopped calculating in expenses when I kind of ran out of the money which I was donating. And it was around £60,000 of what I was able to buy for the donation, which was around 10 to 11,000. It just, you know, this is how people were kind of supporting all of this thing. Yeah, and then I was receiving, there was another massive problem, which people in Ukraine, for instance, they had the money, but unfortunately they couldn't obtain any equipment because the community in Europe is massive, especially in the Eastern Europe. So all of the stuff in Eastern Europe was sold off to Ukrainians in no time. And people had money in Ukraine saying, okay, we've got like starting from the basic equipment, finishing some much more advanced, like because I was dealing with some optics, I was dealing with thermal visors, and those stuff got straight away to the people I personally know. I didn't send it to the hub. It was just targeted donation. And yeah, I was involved in drones. I was involved in SAM tourniquets from the USA, from the New Zealand, from China. And I mean, it's you know, every little helps, as one of the branch in the UK says, of the big stores. So yeah, and then as Roman said, that all of these things gets to the chronic phase when you kind of need to combine your routine, your work, your personal life, and then you know the donation, this surplus of money, it stops at one point of time. So my fundraising got to the end, but you know, like a lot of people, they try. You can never give up volunteering when you start one. So because of the connection I had that time, I got lucky to got involved in the BAPRAS and Orthopedic Association initiative, who is in conjunction with Orthopedic Association in Ukraine. They're doing a webinar series, and I'm helping them to translate that for now, but I hopefully soon be able to join the missions, because they're planning to go to Ukraine as well, and kind of help teach and show. You know, it's not teach, because the doctors in Ukraine, they're quite experienced, Europe basically, but there is things which we're doing more here and things they're doing more there, and if we combine those two things together, we can do amazing things. So yeah, that's basically my experience, and I bet there are thousands of people who can, you know, echo my words, and you know, and yeah, it wouldn't be possible to happen with the massive support we had from the British people. It's undoubtedly because whenever we got, the help was amazing.
Thank you. Thank you, Jaroslav. There are a few questions that have come up, so although our time is pretty much over, I think we'll squeeze them in. Firstly, question to Roman, saying, I would like to know a bit more about your ideas for supporting Ukrainian surgeons who've resettled in the UK. The Royal College of Surgeons of England is a recognised GMC sponsor and operates a sponsorship scheme which recommends non-UK trained surgeons to the GMC for entry on the medical register.
Yeah.
Any comments on that, Roman?
Absolutely. I mean, there are 3 ways of acquiring registration with the GMC, and recently we had a conference dedicated to that matter in some depth. So it's an MTI scheme as well as sponsorship scheme, which colleges run, and certainly we've informed all the doctors who attended. It was about 140 of them, some of them nurses, pharmacists, etc., but certainly a good proportion of surgeons was present. They've been, they certainly have been informed about those routes. So for sure, at some stage, one limiting factor is obviously English. If they are not IELTS certified to a whatever criteria currently is, I can't remember, then I think the conversation will be rather short. So I think there's one of the reasons why they haven't been in touch, even though they know about this route, is because they're getting their English up to the standard, and they've been specifically, encouraged to do that. There are some technical limitations that GMC imposes on the sponsorship schemes, i.e., you have to have continuous medical postgraduate experience without a break. Now, certain doctors come with an obvious break in their career due to firstly moving from the east to west, but equally moving from the Ukraine to the UK. So it's one of those hurdles that we engage with the GMC, and acquiring more information as to how this can be considered, and how those doctors can be supported without breaking any rules and regulations, which obviously are plentiful. And this conversation is ongoing, but we're aware of this. And thank you for highlighting it for those who probably weren't.
Thank you. And on behalf of our college, Royal College of Surgeons of England, we will continue to do anything we can to help surgeons reintegrate or integrate into our country. There's another question which I'll put to anyone who'd like to answer it. What have been your experiences of working with the main aid charities who are members of the Disaster and Emergency Committee, DEC? Have you experienced any challenges with them? Anyone? Tetyana, have you been involved with them?
Well, it's a very good question, and I don't want to disappoint, but unfortunately, we don't cooperate with the charities representing or consisting of this scheme. We don't cooperate with DEC, unfortunately. We would like to. We know that only 15 charities are allowed, have been selected, and we were trying to reach out, and so far we are not successful. So we continue, and we are happy that on our, I wanted to say on our own, and I just look at Tania and realize how wrong I am. We are happy that we have partners here in the UK. We have partners in Ukraine. And we're happy that we have a great support from British audience, from British doctors. I unfortunately didn't show my last slide, where I wanted to say thank you to NHS for the enormous support we have, and to all organizations we cooperate with. And we'd like to have as a support as DEC as well, and cooperate with them. So hopefully at some point they will pay attention to our small little charity.
Thank you, Tetyana. A question I'm going to put to Tania. Someone's written in, I'm really interested in getting involved in the work that you're doing. How can I volunteer?
So we can send details of anybody who wants to get involved to one of our local regional leads. So depending on where they are in the country, if they want to leave their details with one of the organisers today, I'm sure they can get in touch with me or with Roman, and we can direct them to their regional lead, who can then get in touch and have a chat about what they could do.
Thank you. And in case the listeners haven't got your contact details, contact the College of Surgeons and we'll put them in touch. Last question, really. We're perhaps at the early stages of this conflict. What will the future be? What will the future be in terms of the UK Ukrainian community and aid? Have you any thoughts for the long game?
And it's difficult to predict from my point of view, but I think majority of us would agree that we just carry on until Ukraine wins, and whenever it's gonna be. So how we're gonna carry on, it's yet to be seen, because it's a lot of new parties joining the game, and we're getting more and more support. But Ukrainian community would be, as always, as possible supportive as they are.
Thank you.
Well, I guess
sorry,
I
Roman.
don't counter Jaroslav, but equally I think that it's very easy to predict, because unfortunately we've mentioned that the war didn't start on the 24th, it started in 2014, but certainly there is a overwhelming body of Ukrainians who will agree that this is just another cycle of Russia invading Ukraine. So it's important to step back and look at the pattern over the centuries to realize that today it's Putin, as Nazis, I don't know, nuclear weapon, NATO. But in 1941, when Ukraine yet again declared its independence, it was Hitler, Stalin, UPA, Bandera, and same sort of labels or pseudo labels with just different names, really. There was no NATO, but there was annihilation of Ukrainians in 1917 after the revolution, and they called us not Nazis, but Petlurovci. And there was Lenin, there was Germany, there was Friedrich, whatever the Western powers were that invented Ukrainians, allegedly. And then we can do this 40 years, 50 years cycle to 15th century if you want to be entertained. So only labels change, but the intention is that Russians want to destroy Ukrainians. It's very simple, it's very tragic, but that's the fact, and there's no alternative explanations. Please don't follow those temporary labels of NATO, nuclear weapon, Putin, Zelensky, and Nazis, because they're labels that have been utilized and recycled every 40 years with the intentions of Russia destroying Ukraine. And that's as simple as that, as tragic as it is, but it's very, very predictable.
Thank you. A last word from anyone else?
I think, you were talking about how can we see this going forward in the future. I mean, yes, I think it's quite a taxing thing that we've all taken on. It's we have to fit it in alongside, work, alongside family life. It's it's a big job, and a lot of people, I think, are finding it's taking quite a big toll. But as Roman says, I think maybe some people, Ukrainians and non-Ukrainians can see kind of the reason, why we're fighting for this and why we have to do this. It's I suppose it's probably not as completely simple as good versus evil, but then at the same time, there is a bit of that there. It does feel, like well, if you don't do it, who's going to? And I think that if we're going to do this, if people want to help and want to volunteer, then great. We have to just make it work. Have to try and make sure that it doesn't take over our life. That we make sure we leave time for family and for work, so it doesn't all just go fall in down a black hole or something. But no, that it is doable. And it gives you a passion, it gives you something to kind of make you feel that you're actually helping, that you're not just sat there, safe in your own little corner of the world and not being effective, but that you're actually helping and doing something.
Thank you. Well, our time's up, so but I want to thank all four of you for coming along. An hour is a short time to really get to the bottom of everything, but thank you for sharing all that you've been doing, and thank you for sharing what's been really clear, and that's the sort of deep emotion of your homeland, your families, and those you love, which has been really moving. And I'd just like to say, on my behalf and on behalf of our college, that we are behind you. It's a dialogue, as things move forward, and we want to be there with you and alongside you. So thank you so much.
Thank you so much. Thank you. Thank you.
Thank you.
Thank you.
And to our viewers at home, yeah, thank you for listening. Sorry we couldn't answer all the questions, but time had to move on. So thanks to everyone.
Thank you.